Welcome back. They are your local experts in orthopedics and sports medicine and rheumatology, which is a specialty that treats arthritis.
Did you know there are more than 100 conditions that cause the disease?
So this National Arthritis Month, get the treatment you need at OSMS and learn how to support patients throughout the community.
Good morning. Thank you for having us today. We're happy to be here. My name is Lauren. I'm from OSMS, and today I'm joined by rheumatologist Dr. Manpreet Sethi. Dr. Sethi, thank you for joining us today.
Thank you for having me here.
Yeah, so first let's have you tell us about yourself. Why did you become a rheumatologist?
Well, that's a long story. So my first ever contact with a patient was a patient with scleroderma during my first ever clinical rotation during my med school. That had so much impact on her life, and it remained on my mind. After that, the turn of events was like that I don't think I had any other specialty in mind after that.
That's a wonderful story. Thank you so much for sharing that with us. So as a rheumatologist, you see and treat many conditions, including arthritis. This month, May, is National Arthritis Awareness Month.
Yes, it is.
So would you be able to tell us what is arthritis?
So approximately 20 to 25% of patients in the United States are affected by this condition. It causes pain, swelling, tenderness around the joints, sometimes leading to disability, sometimes leading to destruction. There are more than 100 different conditions that can cause arthritis, so it's very important to recognize which one, because some of them can be autoimmune, inflammatory, some of them may be related to injury or age, or other systemic illnesses like psoriasis, sarcoid, etc.
Yeah, that's a lot. I mean, not many people know that there's going to be hundreds of types of arthritis. So what are some that you specifically see and treat?
So in rheumatology, we see mostly autoimmune inflammatory conditions. Rheumatoid arthritis probably would be the one that is maybe most well known amongst the others. It affects women more than men and presents with swelling, tenderness, stiffness of the small joints of the hands and feet, although other joints can also be involved. It can also involve the lungs, and left untreated can cause destruction of the joints. It increases the chances of cardiovascular disease, osteoporosis, lymphoma. Hence, early recognition and treatment is very important for this.
So knowing that rheumatoid arthritis is the most well-known arthritis disease, do you happen to have any other ones that you can mention to us, whether they're also well-known or not as well-known?
Of course. So gout would be one of the more prevalent arthritis, affecting 3 to 5% of the population. Unlike rheumatoid arthritis, gout would typically affect 1 or 2 joints at a time and can be significantly painful, causing red-hot swollen joints and even destruction. This, on the other hand, is caused by deposition of uric acid crystals around the joints that leads to the destruction. And the treatment options are also different, because here we try to bring the uric acid down rather than by treating the immune system.
So Dr. Sethi, how can people support people with arthritis?
So people with arthritis are tough because they have tried to cope up with the disease before even presenting to the physician. So let's try to help them, but without being overbearing. If you know them, I would start by first acknowledging that they can have bad days, and their bad days may be there even when we see nothing wrong on the surface. Their bad days may bring fatigue, mood changes, anxiety, etc. So let's be supportive. If you know them very well and they want you to accompany them to the doctor's visit, let's try to take time to do so, because many of them would like a second set of ears to help them with treatment decisions, because that conversation can be very overwhelming. As part of the community, maybe you can join Walk to Cure Arthritis that helps raise funds to increase awareness, to also help with finding cures for arthritis and support for people with arthritis.
Yeah, wonderful. Walk to Cure Arthritis is an event taking place on Sunday, June 2nd at Green Isle Park in Green Bay, starting at 9:30 a.m. So if you are willing and want to, you can come and support or join our team. And it is a 1, 2, or 3 mile walk. So we hope to see many of you there.
All right, once again, that Green Bay Walk to Cure Arthritis is June 2nd at Green Isle Park. You can find more information at arthritis.org. OSMS has locations in Green Bay, Marinette, Neenah, and Oshkosh. To make an appointment, call 920 430-8113. You can also do so online and learn more at osmsgb.com. And don't miss a single Your Local Experts segment. All of our monthly segments can be found on this section of wearegreenbay.com. Just head to our website, click on Local 5 Live, and then Your Local Experts.